I'm Katie with E&EX News, and we are here at KIMES 2026. I am joined by the CPO of Co넥티브. Hi, nice to meet you.
Nice to meet you.
So what brought you here to KIMES 2026?
Well, actually, this is our first year to participate this KIMES, and we're actually just commercialize our product this year. So pretty much the approval is finished last year. So we are pretty exciting to introduce our new product, and we also excited to see how they see the AI, the market in the KIMES at the same time.
Okay, wonderful. Now let's talk a bit about your company. Tell us about Co넥티브.
Okay.
What kind of company is it?
Yeah, so Co넥티브 actually established in 2021, and we have to go through all the development system. And actually, our CEO is an orthopedic surgeon, so he made this company for his own needs and make sure we just try to help the patients and clinical site at the same time. And we are more focused on the orthopedic field. So, and also more focused on the age generation to, make sure they have a better service in the hospital.
Okay. Now tell us a bit more about the product you're introducing here.
Yes. For this year, so we launched some AI solution based on the orthopedic part. So which is we're more focused on the knee osteoarthritis. So which is based on the care grade. So usually age generation is really hard to understand their status in the hospital.
Yeah.
And they have a struggle with communicate with the clinicians. And also clinician has a shorter time to spend with the patients.
Yeah.
So we just trying to help them to better the image with the AI detection, and also we give the report to the patients and make sure they have a better understand with their status.
Okay, can you tell us how you do that? How do you help them understand?
Oh yes. Actually, our system only used in the hospital, and once the patient's coming to the hospital, and once they take an X-ray, usually the knee problem, the first step is to take an X-ray. So once you take an X-ray, and it comes with the AI's analysis image at the same time. So also, we don't make any kind of the another workflow. We just integrate with the PAC system in the hospital. So make sure there's no time delay. Once you take picture, and there's a AI analysis systems. It's not the separate one. So yeah, it was a one at once the workflow, and also once the patients take the picture, it comes with at the same time with the original image, and you can see all the visualized image how your stage for your knee status. So we also give all the statements, and we visualize all the site, which is the problem with it, and also we hand out the report, make sure you can share with your family.
Okay, that's great. So is this system already being used here in Korea?
Yes, we already launched this product in 20 hospitals in Korea.
Wow.
So yeah, so we pretty much doing the POC, and we also launched in the Abu Dhabi site, which is a UAE site, and yeah, we pretty much under the contract at this point, and also we see the more validate the product see really helpful in the clinician side and also the patient side at the same time.
Okay. Now in this healthcare field, are there any difficulties with exporting to other countries? Is there anything that makes it hard?
Yes, yeah, because since this is a medical device,
Yeah.
so yeah, there's a lot of hurdle with approval and also reimburse system, because AI product itself still we under development all the way through to make sure the more settled in the hospital. So yeah, it has been like 10 years, but we have still have a same process to go through, and we still need to prove this product is going to be really validated at the clinical site. So that's the one challenge, because we take a longer time to the approval system. Yeah. So and also we just trying to approve more than this is gonna be more likely. It's not gonna be replaced any kind of the clinical site.
Yeah.
It's gonna be helpful.
It's an addition.
Yes. So yeah, that's the one thing we just trying to prove in the environment. Yes.
Okay. How have the reactions been? Like, maybe is there any difference between, because you said it's an AI product, is there any difference between the reaction from, let's say, Asian customers and maybe Western customers in terms of how they react to AI in the healthcare field?
Yeah, it is different, because I think it's more likely some environment they're more exposed to a premium service. They really get used to it, but same time time, like, they always, see just the image from the X-ray side, but they also see all the visualized image at the same time. So they see like, oh, maybe they care more about, their status, and actually the hospital care about the patients. That's their, first sight to see, when they see the AI product. And also the doctor itself, like, it's gonna be really helpful to the workflow because, they can reduce the time with the communication with the patients. But that's like a common thing, but the Western and Eastern side is a little bit different because, I think the Eastern side is more get used to the AI system.
Right.
But the Asia itself, they're just pretty new for all the things together. So I think they're more like interested in, how gonna be integrated in the hospital and how they're gonna be managed and how they're gonna be like comes up with the automatic systems. Yeah,
they're fast adapters.
Yeah, and their infrastructure, like itself, like one side, the working with the Asian the hospitals, they're really rapidly developed well. So I think that's the one point, there's like suddenly there's no really big difference between like Westerns and the Asia side.
Okay.
Eventually I think,
Now before we wrap up, let's talk a little bit more about the KIMES Inspire Pavilion.
Yes.
You've participated in that this year. Have you seen what value it offers to your business?
Oh yeah, and actually KIMES is the biggest event for the medical device in Korea. So which is really meaningful. And we also, the Inspire itself, there's a lot of startups and based on the AI product. So I think it's a really good point, the global, the market, and there's a lot of people coming from the globally, and we can actually just more like promote the product at this point. And and also there's a lot of startups still struggling with the, go into the market in the overseas. I think it's a really good initiate point we can start from here to in KIMES.
Well, that's great. Thank you so much for taking your time and talking to us, and we hope that everything goes well for you.
Thank you so much.
Thank you so much.
Thank you.